basic purpose of this meeting is this only, that we don't want a monologue, come here, give a lecture and go down. So it doesn't really make anything interesting. So it is the first round, it's fine, but no, next round I really want everyone to come have a dialogue rather than a monologue and express yourself. It's not your true exam, so you can utter whatever you want. Nobody is going to pull you. But yeah, get your doubts cleared if you have. And I'm sure all of you must be having a lot of doubts. Anyway, so moving on to the third topic, the forward is okay. Okay. Okay, so shifting gears, you must be quite surprised at how come with history taking clinical art of case presentation, we are switching over to artificial intelligence in clinical cardiology, maybe the other side of the spectrum. But as Dr. Satyavan Sharma said rightly so, that you can never separate the history taking and clinical examination from whatever may be the advances which might have happened in cardiology or anywhere else. So that is the reason purposely we brought this topic also at this juncture, thinking that, yeah, you are the generation who are going to face a lot of it, and you have to be prepared for that. Before I start, anyone here who has done any slight interest in artificial intelligence? Very nice. Okay, at least one hand is there. So, okay, for next 15 minutes, I'm going to take you through, I can't really teach you anything on artificial intelligence, but I'll just give you a sneak peek of what is happening with artificial intelligence and why is it important. Okay. So, the challenges are, I'm telling you, take it in writing, that in next 5 years' time, the way we are practicing, it is going to change completely. And our generation may pass off, but you people will have to face it. Okay? There is so much of medical advancements which is taking place. Patients are aware. It is well-informed patient. We get irritated saying, oh, he has Googled it and he's asking us a question. He will ask questions, so better get prepared for that. That you have to answer all the questions which are coming out of the Google, okay? If you get irritated, you are the loser. He is not the loser. And let me tell you one thing is that AI is the last thing which is coming into medicine. AI has literally dominated every sphere of life. Wherever you go, whichever place you go, it is being dominated by AI. The flights with which you came, I can tell you half of the flights are operated by the AI things rather than a manual person sitting there. So everywhere it is an AI. And unfortunately, it is a medicine which is in the last. And fortunately, cardiology is little ahead in accepting AI. You may call it artificial intelligence, you may call it assistant intelligence, or whatever it is. My only point is, don't look it as your enemy. We, medical fraternity, have done this blunder in year 2000 when there was a millennial shift. The whole country, whole world shifted towards the computer side, and we medical people have hardly gone into that. That is the reason many of my generation still find it very difficult to operate computers and other things, because we didn't volunteer it. We didn't want to accept it. We said, oh, this is our domain and we are going to have it. So first thing is stop your resistance towards that. Accept it. If you accept it, you will be the boss, you will be the leader, and you can train it, you can do it, and you will be the master in that. But if you don't, yes, trust me, 50% of you will have a really difficult to establish yourself, because AI is going to take over a lot of things. So what is the all things? Sneak peek, I'm just giving you a small thing that artificial intelligence deals with machine learning, deep learning, computer vision, and different types. I'll show you a little bit of it, what all this means. What it does, automatic diagnosis, continuous remote monitoring, improved decision making, treatment selections, precision medicine, and reduce costs. So one word about the precision medicine. the way we are practicing cardiology at this moment of time will not be practiced like this. What is happening as the whole thing has been done? We are using one size fits all. That's it. That somebody had a cardiac, had an MI, he had an infuval MI, you treat it. You had an antival MI, you treat. These are the things, these are the 5 things, and you treat. It's not going to be like that. It will change. Okay. How it is going to change? It's called personalized, or you can call it as the personal medicine or the approach, where the genetic, polygenic risk scores will be taken into the consideration, and it will be suitable considering the genetic, considering the environment, considering the risk factors, that patient can be treated or will be treated. So it is again change. What is may happen, I'll show you in my next few slides, that probably in India we're still not doing it, but in many of the countries, how patients are being treated, how the whole diagnosis is done. So what is this artificial intelligence is? Again, another small thing which I really wanted to tell is that I don't know about all of you, but a lot of medical fraternity thinks, oh, come on, shut up. Computer cannot do anything about it. When I'm not going to, whatever I feed, that is the only thing it is going to tell me. Partly right, partly no, wrong. Okay. Don't think that, if you are feeding wrongly in computer, so you are a smart guy and the computer is not a smart guy and it's not going to give you the answers. You're mistaken there. So artificial intelligence is a field of computer science that studies the design of intelligent agents which takes the best feasible action in a given situation. So basically what it means is, it all goes back to 1950, whereas basically Alan Turing is the father of AI. And he's a mathematician from England, and who actually devised the first code in Second World War, which actually tried to read the code for the German missiles. That's how the England took over the Germany. So that is the first thing, the word was coined, can machines think? And I'm telling you, yes, machines can think. Okay, so don't be under the a confusion that, machines can't think, only humans can think. And I don't think so. So basically, going forward, the Turing test, there is something called as a Turing, I don't know how many of you are aware of it. What is Turing test? This is again can be asked. Turing test is, suppose if I'm interacting with a human being and a computer, they are not, both of them are not visible, but if I'm not able to differentiate that who is the human and who is the machine, that means the Turing is equal to 1 for that machine. That means the machine is as good as a human being. Okay. And now, majority of the equipment, a majority of the devices which are available in day-to-day practice in clinical cardiology are having a Turing test of 1. Okay. So basically, it's acting humanly, thinking humanly, acting rationally, and thinking rationally. Okay. Artificial intelligence, in other words, works like this, that primarily it has got both the components. It can act like a human being, it can rationalize like a human being, and it can give you the output. Okay. So these are the few small things which I just thought to take you through, that machine learning and deep learning, these are the 2 words which are often used in AI. Okay. Machine learning is a part of an AI, is a part of a computer science, which basically allows a system to learn from the data, and then rather than explicit programming. So it's not like that the computer, you program it, you do a coding for 3 days, and then after that you come out with the result. It doesn't work like that. It learns from the data. The machine learning is, it learns from the data, and then it gives you the results. So the only thing what it depends is the data. So data becomes the king. And so much of billions of data. I just will take a detour here and tell you that I don't know how many of you are aware of thing. There is a program called Karya. Anyone who is aware here? Okay, Karya is a one program which is done by a Bangalore-based an NGO, and it's feeding the uneducated women almost like a 30,000 rupees per training thing, which happens for 3 days. So you may be thinking, what I'm talking about this about. So basically, what is happening is the government of India, all the governments and everywhere else also, they are allowing AI specifically in 3 fields: education, health, and of course the communications. So and finance, not communication, finance. So in these three things, what is happening is literally it will take over the whatever we are doing at this moment of time. I'll come to that, what I'm telling you. Going back to the Karya is, here this is an uneducated lady who narrates on a phone or a system in her own language, in her own vernacular language. There are hundreds of thousands of languages which are spoken in our country. Unfortunately, the US and other people are not having that language database to make the programs which can reach every nook and corner of not only India, but all Asia and all across the world. So this data collection for the language, the billions of dollars have been spent by all the major three companies, Google, Microsoft, and the Apple, and who are actually investing. So this Karya is one such program which is really, so what I'm saying is, we are all educated people are bypassed by technology, and it is going down to the end user technology people who are actually at this moment benefiting it, and eventually they will start using it also. And so we have to get aware ourselves that what this AI business is. So machine learning is this is how it learns from basically what it does is it makes the patterns and then that is able to make the decision and predict outcomes. There are three types of the supervised learning, unsupervised learning, and reinforcement learning. There's no point going into those details also. So deep learning is the one which is important. It is inspired by the complexity of the human brain. So like learning data and generating patterns. So this is where we get cheated. We don't understand that. So if you use a deep learning, which has got various neural networks, the way we have a neural network in our brains, we have neurons. Similarly, these neural networks have billions of nodes, which literally works like a neuron. And what they do is there are multiple layers of them. And these layers, whatever is the input data, from there they understand the pattern, and they come out the outcome. Still, I may not be able to probably explain you what I meant by this. Now I'll take you to this point. Yeah. I think here the things will little bit be more clear. Traditionally, what happens is we are all like, in medical research, whatever is the research is happening, statistics is the base, is a standard method to be used. So what we do is we normally propose a hypothesis. After proposing hypothesis, we do some equations. The statistical analysis is being done, p-value, confidence interval, and everything we do it. And then we try to get the outcome. So which basically, what it does is give how much is what are the risk factors for the disease, what is the outcome of a new treatment. So we are tuned to think that you have a causative factor and you have a product. And that is how the medical research has been going on all these years. So cause and effect relationship has been established. So we propose a hypothesis, and that hypothesis is validated by that particular statistical analysis. So that's how we say this particular treatment is good, this is not bad, this trial is correct, this trial is not good, it is negative predictive, whatever you can call it. Okay. But AI doesn't do that way. It all requires is a data. It doesn't require a hypothesis. It can learn the non-parametric relationship between the different risk factors. It can see what are the patterns. How do we think? How do we memorize? Generally, human beings memorize by the patterns. We don't have an algorithms in our brain. We have a patterns. We have a patterns, and the same pattern is again recollected, and that's how we memorize, that's how we take decisions, and that's how we become an intelligent person. So it is the patterns. The neural system, the networks also does the same thing. They have a pattern. So they read the patterns. It doesn't require hypothesis, but it can give you the outcomes. And those outcomes many times are inferior to the human outcomes, many times equal to them, and many times superior to the human outcomes. So I hope I'm a little bit able to clear that what exactly the AI, how the artificial intelligence works. So this is what AI data is driven and does not require the formulation of hypothesis. It makes predictions with high accuracy without needing to interpret the data. Its goal is to identify hidden patterns in the data and predict new data. AI is able to use very complex non-parametric models from the vast amount of data in comparison to simple parametric models requiring a suitable size data set used in the statistics. So that is where the problem comes. We think it has to be statistically correct. So where you apply statistics is a very simplified way of approaching any problem. It just sees a linear correlation between the data points and the outcome. And then it gives you the results, whereas the AI works in a different fashion. So on that behind, so I'm not here to, boast my things or whatever I did, but yeah, we did the first ever artificial intelligence-based cardiovascular disease risk score, and which has been validated all across the globe. But I'll just take you to this slide only, that basically coming back to the point is that normally in cardiovascular disease risk scores, the Framingham and the Q risk, Framingham is the risk score is the most accepted, the CVD risk score. But we have seen that Framingham failed in most of the things, and it failed in our country miserably, because when the randomized trials were done with this Framingham risk source, or whatever the cardiovascular, whether it's a Q risk or ASCVD, all of them, the problem is the accuracies were hardly 59% or 51%, so the outcomes were not different. Whereas with AICVD, what we evolved over a period of in the last 4 or 5 years, the accuracy is nearly to the 81% or 85%. And when I go all abroad, all across the globe, and when I talk to our own fraternity people and tell them that AICVD could do this, so they generally feel that how is it possible? You are telling the same risk factors, you are telling the same thing, but how come your scores are better than some crap is there? So I'm trying to put you that only, that if you can read the non-parametric correlations between the different risk factors, your outcomes will be different. Now, with this background, similarly, we are working something on heart failure. Heart failure is basically, all of you must be knowing that there is a HFrEF and HFpEF also. HFpEF almost occupies the 50% of the total heart failures. But HFpEF is one unfortunate thing which most of the time cannot be diagnosed clinically. There are hardly any symptoms are there. Symptoms are there, but there are hardly any signs are there wherefrom you can really make out that because it's a preserved ejection fraction. And it affects the 50% of the total population, and the prognosis remains the same as the reduced ejection fraction is. So what we have tried to do is we have tried to analyze the data of these ECGs who are clinically normal, clinically non-significant, but we could break the ECG in them and then predict 10 years that who are the people who are going to develop HFpEF or who are going to develop a HFrEF. So that is one remarkable thing which we could achieve. We are going to publish it in Lancet and other things. Forget about all those things. My point is why I'm talking to you all this point is, trust me, tomorrow or after 2 years or 3 years, whenever you sit in your clinic, whenever you're sitting in your hospital, the patient is going to come to you with a diagnosis. You don't have to do a diagnosis part of it. Okay. It will be 99.9% his diagnosis will be done, because the advancement has taken so much, the wearable devices are so much. IoT is an Internet of Things. Internet of Things is that two devices can speak to each other, can communicate with each other without even switching on. So if I have one device and some device in US or in a remote area of some Nalgonda, wherever it is, two devices can communicate with each other through an IoT platform, and that will evolve. So that is the reason what is happening is that most of the people will come to you with a diagnosis. So you need to be abreast with that. You have to be prepared yourself with that okay, you don't have to get irritated with this guy is, posing off, he's a doctor, I am the doctor. You will have to shun those qualities of us and then start dealing with. So I'll show you one thing is that we think about coronary angiogram, that is our bread and butter. And this is the, sorry, yeah. Oops. Can we run this, please? Sorry? No, it will come now. Okay. So you can imagine this is the clarity of angiogram on 4D photon counting cardiac CT. So I don't think so when you have such a clarity on 4D photon counting CT, people are going to come for a regular coronary angiogram with an invasive coronary angiograms and other things. There is a study which is done in China, which is basically doing a facial reading. And it is predicting 5 years down the lane that who is going to get a CAD and who is not going to get a non-CAD. Okay. It is already, the trial has come, they have already published the results out of it. Similarly, the ECGs we think it's a digital ECG. Digital ECG is a crap because most of the time the diagnosis is bullshit. But now you have AI-powered ECGs, which has been tested with a board-certified cardiologist. Board-certified cardiologists, 6 of them, their accuracy was 90%, AI accuracy was 99.7%. All those who are doing an echocardiogram, please remember that your echocardiogram, what you are trying to interpret, there is already a software available, which it is taking 8 seconds for one echo to interpret. And so in about half an hour's time, almost like 1,000 echoes can be reported precisely than what a cardiologist can do. Okay. What an MRA is doing. So AI has literally invaded every sphere of our field. My request is not to frighten you or anything, but please accept it as one more tool. Because there are the engineers, beauty of the engineers is, because I worked with a lot of Microsoft people, I worked with a lot of Google people and other things, very top guys. Fortunately for us is, they don't have that much of domain knowledge on cardiology in our subject. Similarly, we don't have too much of a knowledge on the computer side. I had to learn a lot of it. So all those youngsters, please don't be away from that. Try to imbibe, try to have a little bit of an idea, you little bit read, and your domain knowledge on this will help you to grow, and it will help you to grow yourself also. Thank you so much. Okay. Now, moving on, again, coming back to our traditional thing is the JVP, which is, again, a very critical thing in examination. I'll request Dr. Hiten Shah to come, please address.
Yeah, please. Shiv Kumar, I think we are fortunate AI will diagnose maybe, but therapeutic treatment at least is with us only, don't worry. I don't think AI can directly treat and put stents, angioplasty, at least in our lifetime, all the cardiology community is safe.
Srinivas, I'm not in debate with you.
That also will be done? That also will be done?
I'm telling you.
No, I'm saying
okay,
angioplasty.
There is a software. What they have done is, because we thought that robotics are only until unless we connect and do it. Okay. So what they have done is they have taken the 20 best operators, which included Antonio Colombo also. Okay. They have taken the 20 best operators, their methodology, and that has been captured into AI tool. And so later on, it will be included into the software, and then that will be completing the procedure.
Hope it not happens in our lifetime. But one thing I can confidently tell is, though AI may not replace totally, but doctors who are accomplished with all these new gadgets, new AI will be better off compared to those doctors who are not aware of this. That much is certain. So I think all of you should, why he wanted to give a basic idea is, you should always have some sort of basic idea about what is new coming up in technology. And because doctors who are comfortable with this will be better off in treating, diagnosing and dealing with day-to-day patients compared to those doctors who do not have it. At least it can help us in a lot of things. So ChatGPT, how many of you used? I don't know. If you type everything in ChatGPT, today we are having this program, what I have to talk, it tells you tuck, 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 10 points. So knowledge is freely available. The only thing is we need not ratify, mug up like when we were students. Everything is there. How to know, interpret it, how to deal it is what you have to understand. But all the new things which are coming up, please be aware. How many of you use ChatGPT sitting here? Yeah? So Google has become a little old now. ChatGPT will exactly formalize and tell you how to write it. I'm supposed to present. So tomorrow I'm talking on this. What I have to suppose, you type it. The speed how it comes also is too good. In less than a minute's time, it gives you full chart, what you need to present and all that. That is fantastic. So like that, I think you need to be aware of what is happening and all of you become comfortable. And some of these gadgets also I thought Shiv Kumar will touch, but it's on the age. All this auscultation business also has now become, this technology has helped us. Like you have stethoscopes which can directly give you ECG and the murmur comes there. Like what you call as phonocardiogram is already coming onto your iPhone, already coming on the displays on the screen. So that is definitely a help for diagnosing. And it's in the COVID times, it has been used, tested very aggressively to transmit the data somewhere also. So like knowledge, the country barriers are also gone with the help of technology. The murmur, which I wish I can show it, we have started using it to put the patient, especially when you're doing a balloon mitral valvotomy or a TAVR, you put that stethoscope, record it before and after, that thing disappears. You clearly know what is the murmur like, how is it coming. We have been using it. So those some of the gadgets are really useful things are also coming. Like how ECG is captured. Now auscultation also I feel is very interesting, sir. Previously those stethoscopes were expensive. Now it become cheaper also. Siemens stethoscope also has this now.
Basically, I'm using the same stethoscope. Okay, I have with me, and yes, I'm telling you that it's so easy. Okay, you can see it. You can see record the murmur. You can hear it later on. You can see what is the difference between the thing. And in fact, I used it the same thing for a TAVR patient. I did it before and after. So I didn't touch those things which are too basic things because they have already come into the market, I'm sure. And all those who are using ChatGPT, it is a generative AI, okay? There again, the problems today we have is ethical issues. Those are the major challenges for us, the data. So those things, anyway, we can go on for a long, so sir will say, and then after that I'll go to
I can assure all of you that whatever Shiv has told you is really going to be there in the year 2050. Whatever myself and Satyavan Sharma have taught you just now, it will be relevant for your examinations. So please remember that and memorize and mug up that. Please be sure. I can understand. But Shiv, I tell you, now even the artificial intelligence fathers, like you must have read Hilton. His name is Howard Hilton. One of the father of artificial intelligence. In protest, he resigned just about a couple of months because he looked at the future and he felt that the future is going to be such that this artificial intelligence is going to control all of us. And that's where 26 countries, including UK, and I think India is also a signatory to this, that there will be restrictions on this artificial intelligence. So please don't take this for granted because artificial intelligence is going to be restricted. I hope not for medicine.
No, but you're absolutely right. That's what I was saying, ethical issues, because the AI now is facing one of the major challenges is in ethical issues because it can create a havoc. It can create havoc not only in medicine, it can create in everywhere else. So the data can be, because there are a lot of things in that which can be misinterpreted, which can be misused, which can be abused. So for that's the reason many of the governments are taking forward and until unless this is sorted out,